It's a pleasure to meet you. My name is Dr. Al Friedman. I'm coming to you live from picturesque Westchester, Pennsylvania, outside of Philadelphia, where I am a practicing counseling psychologist, and I specialize in working with families affected by rare disease. I'm also a father, and I was fortunate enough to have a son who was affected by SMA and lived for 26 years. He passed away this past October. So I know very well the challenges you face as AGS families, and having studied up on AGS and seeing the beautiful photographs of your children online, I want to share with you my admiration and respect for you, what you do, and the community that you're a part of. As a practicing psychologist working with our families for many years, I have come to learn a number of lessons, and I'd like to share with you just for a few minutes a few of the lessons learned over 25 years of being a psychologist and being Jack's dad. The first lesson I've learned is that a diagnosis of a rare disease is very traumatic. It's very hard to have the expectation of a healthy child and then find that your child is affected by a complicated disease without treatment. That's what happened to me too back in 1995. It's a trauma that you never forget and is kind of burned into your soul. And you find yourself launched into a twilight zone that most people cannot relate to. It's not easy to live with the uncertainty that comes with this diagnosis, and it's very hard to live with the challenges associated with parenting a child with this diagnosis. So that early, those of you who are early in this, I, um, I, my heart goes out to you, as I know it can be very difficult to reorient to this experience. So when we are left with a diagnosis, and we're not left with a whole lot of hope sometimes in certain situations with certain diagnoses, where do we find hope and where do we find strength? The lessons I've learned along the way are that our families are critically important to us to provide support, and so are our communities, our neighborhood communities, our work communities, our faith communities, and our rare disease advocacy groups like your group. We find strength and we find hope in each other, and we find strength and we find hope in others whose paths you follow. Many of my best friends are parents who've had kids with SMA and who were older than my son. I look up to them, they guided me, and I try to pass it down to other parents along the way. Parenting a child with SMA or with any rare disease like AGS is very, very hard work. It's hard to live with uncertainty, and it's very important to take care of ourselves. One of the lessons I've learned in these 25 years is that we all need to make sure we get enough food, enough sleep, enough exercise, and that we do things that nourish us so that we have the emotional fuel in our tanks to take care of our kids, because they require a lot of attention and a lot of energy. It's very common when we're parenting a child with a rare disease to have mental health symptoms, to be sad, to be tired, to be scared, to be anxious. These are all very common symptoms, and these symptoms can disrupt our sleep, can disrupt our appetites, can make it hard for us to enjoy the things we enjoy. As a psychologist, I'm often asked, Dr. Al, how do we know when it's time to reach out for help? And the answer to that question is, if the symptoms we experience disrupt our day to day functioning to the point at which we can't function well, and they've really disrupted our day to day, that's when we reach out for help. All of us who have kids like ours are going to experience some of these symptoms some of the time. But when they disrupt us to the point at which our functioning isn't healthy, if we're not healthy, it's time to reach out for help. Um, and finally, just the last point for this short presentation, and I look forward to meeting you during your conference. I've come to believe in my 25 years that along with a rare disease, our kids also have some very unique and rare gifts, gifts that we may not realize they have when they're first diagnosed. I've come to realize that our kids with rare diseases provide the gift of resilience. Our kids are determined and they're resilient, and they're role models for others because of their own attitudes and their own determination to move forward with their lives, however limited they might be. I also believe that our kids have the gift of providing perspective to others. My son, for his whole life, without saying a word, would drive his wheelchair into a room and everybody else's big problems got small very quickly. Our kids give the gift of perspective. A third gift that our kids have is they're magnets for compassionate, open hearted people. If our kids were healthy, we wouldn't meet as many wonderful doctors and nurses and researchers and caregivers as we do. And although we wish our kids were healthy, and I wish my son had been healthy and still here with me, I can't tell you how many wonderful, open hearted people he attracted to his life and to our lives. There aren't many people who do that as well as our kids. And finally, our kids bring out the best in everybody whose path they cross. They have that special gift of bringing out everyone's best. I know that my son has brought out the best in me and everybody around him for his 26 years, and I'm sure your kids do that as well. I thank you for this opportunity to um, share with you at your conference. I'm new to AGS, but not new to rare disease, and I'm here to help any way I can. And I look forward to meeting you on Saturday at your conference. Thank you so much for having me.